I've read through thousands of extracurriculars and saw why most premeds don't get in. Their clinical experiences suck, and that could be you. On the other hand, these premeds got into the best medical schools in the country. I spent hours analyzing their strong clinical experiences, and today I'll share with you the 5 things they all have in common. The spicy clinical experience formula. I'm Mike. 10 years ago, I started my pre-med journey at UCLA. Today, I'm a doctor, an anesthesiology resident in New York City. I also help thousands of pre-meds get into their dream med schools. The spicy formula. Spicy stands for story, progress, initiative, connection, and yield. In my head, this is also the order of importance. You must have story and progress in your clinical experiences. Initiative is important, and connection and yield are nice to haves. You do not need all 5, but we found that the strongest clinical experiences do. For each component, I'll clearly define it and show you an example that stands out. Then, whether you're writing your clinical experience or searching for the clinical experience right for you, you'll have a formula to follow. Everything in med school admissions is better with clear examples. And there's no better examples than real clinical experiences from real pre-meds. We have 8 full AMCAS applications from students who earned acceptances to the best med schools in the country. Over 11,400 pre-meds are part of our community. To join, click the application database link in our description box below now. Key number 1, stories. Stories are the most important part of a clinical experience. It's also the part most pre-meds get wrong. For example, what do you think about this story? On New Year's Day, I was washing dishes when I heard Kate making small gasping noises. I plunged my fist into her abdomen and pushed upward. The food was not coming out. I kept going as the blood rushed to my limbs. Many pre-meds believe that the more dramatic the story, the better. No. Stories are specific patient narratives that detail your involvement within medicine. AdComs are not looking for pre-meds who can perform an emergency intubation or have seen some life-saving brain surgery. In fact, that's a skewed understanding of medicine you'd expect from a layperson who just watches medical TV dramas. Pay attention to this story instead. What do you notice that's different? John, a 12-year-old boy with Crohn's disease, often spent weeks cooped up in the hospital. He's been through a lot. No kid should have a feeding tube and be connected to IV poles. When his crayon-signed card disappeared and reappeared folded inside my mouth, his eyes opened wide with amazement. In that moment, he was no different than any other 12-year-old boy. This is what you're looking for. Clinical experiences where you can intimately understand real people going through real seasons of their health. Now, every pre-med will remember S for stories, but there are some stories that help and clearly some that really hurt. And it's this attention to detail that separates pre-meds who become doctors from those who do not. And if you're applying to medical school in the coming year or 2, you do not want to make the wrong decisions. Our pre-med Catalyst students that submit their applications on time have a 92% acceptance rate. That is more than double the national average. And our results are because we work so closely with students. In fact, we can only take 4 students per month until we're full. If you'd be interested in earning acceptances to some of the strongest programs in the country, click the application cycle advising link down below now to book a call before we're full for the cycle. Key number 2, progress. We define progress as the development of a mature understanding of medicine. The most common combination is a powerful patient story whose care you were involved with. Layer on that a mature reflection or takeaway, and you've now shown AdComs progress. Pretend you are an AdCom. What did you learn about this pre-med? Before working in the ED, I believed that the best physicians had definitive diagnosis and advanced treatment plans. After witnessing countless cases where even experienced doctors had to navigate uncertainty, I learned that honest communication about what we don't know can build more trust than pretending to have all the answers. When a mother brought her child in with unusual symptoms, I admired how Dr. Lin openly shared the diagnostic challenges, yet still providing reassurance that she would take care of the child as if it were her own. Here, you meet a pre-med who understands medicine isn't perfect. It's not a multiple choice question with one right answer. This is a student who understands that the best care involves sharing the experience with the patient. being a guide and not a paternalistic, all-knowing, do this and do that type of doctor. And if you're applying to medical school in the coming year or two, that first type of doctor is the one you want to come across as. It'd be an honor to support you, but we just don't have the bandwidth to support more than 4 students per month. Click the application cycle advising link down below now before we can't take on any more students. Key number 3, initiative. We define initiative as going beyond your expected responsibilities to identify problems and create solutions. Medicine is a team sport. This month, I'm on the OB floors, and us anesthesiology residents have to work together to make sure all the women in labor give birth to their children safely and comfortably. One person checks on the woman who gave birth yesterday. Another ensures that all the operating rooms are set up and equipped for an emergency. And another places epidurals for the woman in labor. So why do AdComs care if you show initiative in your clinical experience? Pretend you're an AdCom. What do you see in this student? I also developed a system to increase the efficiency of the medical room. I created an Excel document for the certain patients that needed their workup complete prior to being seen in our clinic. Before our patients for the day come in, we divvy up these patients and ensure that all loose ends are closed. I felt proud and honestly amazed that a simple checklist system helped our clinic ensure that these deserving patients could make the most of their appointments. This is a pre-med who's seen enough patient visits where the echo wasn't done or the MRI wasn't scheduled. And she did something about it. If you've shown initiative in the past, AdComs reasonably assume that in the future, you'll be that lifesaver teammate when you're on call at 2 a.m. and everything is going crazy. Key number 4, connection. We define connection as authentic emotional bonds formed with patients that demonstrate empathy and interpersonal skills. Now you might ask, what's the difference between stories and connection? Stories point more to involvement and activity, that this really just wasn't a shadowing experience. Connection is a cherry on top. It focuses on the humanism in medicine. It's these details that show readers that you might not only be good at the job, you might grow to love medicine too. We talked about his favorite Pixar films and decided on Finding Nemo, a shared favorite. Over the next few weeks, I became accustomed to seeing Ben walk the floors, inseparable from his bright orange Nemo plush. I couldn't help but smile every time I walked past his door, labeled 42 Wallaby Way, Sydney. While we lived such incomparably different lives, I found our shared love to be infinitely meaningful. Key number 5, yield. Lastly, we've come to my personal sleeper key. Yield is evidence. It's the measurable, quantifiable impact that you personally drove. You can point to it. It is undeniable. This is one level above initiative because now you've proven you can make meaningful, lasting change. For example, if you had a pre-med do this, what might you expect they would do on your campus? At our last health fair, the average annual income of the 350 patients was $10,000 to $30,000. 37% had no insurance and 48% spoke little to no English. Moreover, 59% were at risk for hypertension. With this data in hand, we partnered with Covered California and successfully enrolled 127 patients in insurance. Of these, 52% saw a provider in their native language within 3 months. This is a pre-med who has made real, lasting change in their community. If you are an AdCom, this is the person you want on your campus so you can pour more resources into them and be a part of the grand change they will make. And that's spicy, the 5 core components of the strongest clinical experiences. We came to this only after distilling thousands of applications from reading years of really strong pre-meds. And there's a ton more that we've learned. You'll want to know now the 4 brutally honest lessons that I learned after reading 500 medical school applications end to end. That video is here. Thanks for your time. Goodbye.